having said health, it's time for Minister Tufton, and he's been doing so many things. I see field hospitals going up. I see the teams working. And of course, Minister, on behalf of all Jamaicans, I want you to convey to our nurses and our doctors and everybody who works in a hospital, how grateful we are to them. It's been difficult circumstances, but they never stopped working. And so thank you, Minister, and thanks to your team too.
Thank you very much. Good morning, everyone. Morning, colleagues, and all of the persons who are here. So the following is an update on health. The field hospital in St. Elizabeth has commenced operations. I checked this morning. They have seen about 50 patients over the past 24 hours. It's an accident, an emergency facility with a number of services, 13 patient beds, operating theater room, surgical procedure, emergency room, obstetric and maternal and neonatal care, and lab and pharmacy services and blood bank. So it's a full-fledged operation, and it's now active on the ground, which is a very positive thing. It's equipped by about 60 professionals which came in from the US, but they are also teaming up with our local doctors. So it's a combined effort in terms of the response. Supporting the hospital services is also a field clinic, for want of a better word. So we're mounting a primary healthcare facility on the grounds of the Black River Health Center. It's taking place as we speak. What that will allow for is a triaging process of the non-essential cases, because everybody will come to the hospital. Not everybody needs that kind of service. So that facility will be up hopefully by today, and then once it commences services, the health team, both the local health team and the supporting health team, will be there. That will provide very critical services in the parish of Black River, well, the town of Black River, supporting the parish. Beyond that, yesterday I went to the airport with the Spanish ambassador, EU ambassador, and representatives from the Ministry of Foreign Affairs, Foreign Trade, to meet 76 citizens of Spain, doctors, nurses, technicians, engineers. They are also going to be deploying a field hospital. I understand that it's on its way now from Kingston, should be in Falmouth by now. And we're hoping over the next couple of days, a second full-fledged field hospital will be mounted in Falmouth with all the services of emergency care, surgery, pediatrics, traumatology, physiotherapy, psychology, general anesthetic services, radiology services, lab, pharmacy, sterilization, and so on. So a full-fledged facility, the second field hospital. We're hoping tomorrow I'll visit that site, and we're hoping that that will be up and running. That will take a lot of pressure off the Falmouth Hospital, but will serve beyond Falmouth. It could go over into St. James, depending on where the challenges are. So that's a positive development, and we want to thank the people of Spain and the European Union for that collaboration. We're working on a third field hospital to be deployed at the Cornwall Regional Hospital in Montego Bay. This one is a discussion which I'm told is close to finalization with the people and government of Barbados, which will be flown into the island hopefully sometime soon. That will also come with all the things that I've just described for the previous ones, and that will provide critical support for the Cornwall Regional Operation and the people in St. James. And I will provide more details on that once we get those details. The Sablamar Hospital is continuing its emergency support services. We have one post that is mounted there by a medical team, a NGO. They have gotten their certification, and they will start operating this morning. And again, they will provide critical support for triaging of patients who don't require emergency care. We're looking at the possibility of expanding the services at the Savlamar Hospital. Some discussions are taking place, but too early to make any definitive statement. As far as White House in Westmoreland is concerned, the eastern side of the parish, which was ravaged by the hurricane, we are working with Samaritan's Purse to locate a tier 1, for better understanding, a field health center at that location from where we will operate to go into the hills and give support from that base. We are exploring the possibility of a field hospital between White House and Belmont, and some conversations are taking place with some possible partners to see if that is possible. So it wouldn't be located at a hospital site as the others are being located. It would be a separate, standalone facility because that area was ravaged terribly, and the logistics of movement into Sav or Black River, as the case may be difficult. So we'd like to look at expanding our services there. In terms of pharmacy services, we have begun mobile pharmacy units managed by the National Health Fund, and they have been out. So far the unit, these are multiple mobile units now. They have gone into Black River, Slipe, Grove and Brompton in St. Elizabeth, in St. James. They have visited Maroontown, Negril and Little London in Westmoreland, and those efforts are continuing. Location for mobile services include Newmarket, Pepper in St. Elizabeth, Darliston in Westmoreland, Ramble in Hanover. And we'll offer pharmacy services at Granville Health Centre in St. James and at the Prattville Health Centre in Manchester. The NHF is now building out its ecosystem. What we're doing is mapping the secondary healthcare infrastructure to determine where they were badly damaged and taken out of commission, and then placing on top of that the possibility of the temporary field health center structure, which will be accompanied by both local and those volunteering coming into the island once they're certified to give the community-based support. So once we develop the emergency services, then we are focusing now on the primary healthcare services, which is the community services, and that involves providing medication and critical care to those individuals in those communities. And that has started and will continue and will be expanded over time. In terms of vector control, the team are out. We do anticipate an increase in vector-related activity, whether it's rodents or mosquitoes. 413 temporary workers are engaged, and we're going to be supporting those temporary workers with 498 permanent staff. And you will see and feel and hear more of them in the communities in the coming days, because we do expect over the next week or so, particularly in the areas where we have no electricity, that's going to be an issue. And there's always the risk of dengue caused by the Aedes aegypti mosquito. Just to note, that's only one species of several species, and so we are monitoring and testing to determine exactly what the species are and how we deal with them. The same applies to the public health inspectors. They have been mobilized, are in the field looking at food, the food chain. We have already condemned a fair bit of food that is to be refrigerated and can't be refrigerated, and also doing water testing. All of that in aid of preventing infections or diseases from food or water. Last Sunday, we had a team of 200 that went to visit the 5 hospitals from Kingston, healthcare workers. And it was really a good show of solidarity and support for those healthcare workers who have been impacted. They helped with the cleanup. They're going back this weekend to those affected areas to continue to assist in terms of the cleanup and restoration. Moving fast in the interest of time. This week we had a donor and partner support meeting. Ministry of Health met with in conjunction with the Pan American Health Organization, met with a number of donors, I think over 30. And these are organizations, both local and overseas, NGOs, multilateral, bilateral partners. So we have basically brought all under one umbrella. I'm saying this to say for those who have an interest in supporting the health response, there is a central secretariat that will coordinate that, and that's very important to avoid confusion and to ensure that the coordination is intact. There is a email, hurricaneresponse@moh.gov.jm. That's hurricaneresponse@moh.gov.gm, that you can send any request, any offer of support for health to, and we will direct it appropriately. And the final point is on mental health and psychosocial support. We now have a PAHO expert who I met with yesterday. There is a plan to engage all our field officers, not just our psychiatrists and psychiatric support teams, but all our field officers who will be in the field, to discern where necessary the need for some sort of psychosocial support to persons who have been traumatized in this activity. We will have a base at each hospital, and so it will involve some amount of training or orientation, and we are seeking volunteers, so persons who may have training in this area can use this email to reach out, and we would be happy to incorporate them into creating this army of mental health practitioners or support team, because we have seen and anticipate that the mental trauma on persons who have been victims of the storm will only get worse, and we need to be there to offer that kind of support. Thank you very much.